And welcome back. Well, it's hard to imagine a child that doesn't like to smile, but for some, a crooked or overlapping teeth, they're just too embarrassed to show their pearly whites. So joining me now is Dr. Erin Kopecki from Dental Associates with a little Orthodontics 101. Thanks for being here.
Thanks for having me.
I mean, the truth is, kids, what is it, between 9 and 14, that's when the majority and lots of kids have braces.
Yeah, that's
but it's getting nice out. And kids are going to start playing sports with them. What do they kind of need to know about this time of year with braces?
That's a great question. Although it doesn't really feel like spring today.
Not yet.
Yeah, hopefully soon. You know, kids are definitely playing sports more often this time of year. And so it's really important that whenever a child has braces on and they're playing sports, that they're wearing a mouth guard to protect their teeth and their braces. So this is an example of an orthodontic mouth guard.
Okay.
And you can see it's basically just kind of a set of trays that fits
it's
around the top and bottom
rubbery
teeth.
And flexible.
Yep, and it's actually pretty large, so it will fit around the braces and the teeth themselves. This is a little bit different than the more traditional type of boil and bite mouth guards that you'll see that kids usually use. Those are more closely adapted to the teeth, and those aren't really recommended for braces because they don't allow the teeth to move, which is what we're trying to do with the braces. Yep.
So this is something that you'd have to get from your orthodontic.
Yep. So yeah, I supply this to all my patients. You can also pick these up at your local drugstore as well.
Okay. Yep. Easy. Okay, that's good. Good to know. So that's the thing that you need to have if your kids are doing some sports.
Absolutely.
What kind of problems are you usually addressing with kids that have braces? The overbite, things like that?
Well, there's a lot of different problems that we see a lot with bites. So really, orthodontics, you know, it's to align the teeth and also to create a good functional bite. So when I look at a bite, I look at it in 3 sort of different dimensions: horizontally, vertically, and widthwise.
These are bad bites.
So yep, this is a patient of mine who has you know, a little bit going on with her bite. So as you can see, the top teeth are sort of tucked in inside the bottom teeth. That's called a crossbite.
Okay.
So that's something we definitely want to fix. And you can also see on the sides there, her teeth aren't really touching each other. So that's called an open bite. And those teeth aren't functioning at all for this patient right now. So this is someone I would absolutely recommend braces for.
How long would it take to correct a bite like that?
You know, honestly, she has a lot of crowding. She has a pretty significant bite issue.
Couple years?
So I would probably say around 2 to 2.5 years.
Yeah.
So she would be, you know, sort of on the longer end.
But on a grand scheme of things, that's no time at all, especially when you're a kid. Now this is looks like a beautiful bite.
Yep, so this is a patient that I finished recently, and as you can see, widthwise, the top teeth are just on the outside of the bottom teeth, which allows for ideal function of the bite and chewing forces. And then also all of the teeth back to front are sort of interlocked, kind of like a zipper, which is what we're looking for.
Okay.
And in front, you know, there's not too much overlap of the teeth, but again, she's not open in front. So those are all things that we're trying to achieve with the braces.
Okay, so self-disclosure here, I was really bad. I sucked my fingers for a long time, and that gave me a pretty bad overbite in some sense, you know, and I also have very crooked teeth. I can imagine that these are some of the things that cause the bite or teeth problems. Are there others?
Well, you know, unfortunately, a lot of issues with the teeth and the bite are inherited. So, you know, whatever whatever your parents' teeth look like, a lot of times is what, you know, what the kids' teeth are going to look like. But again, like you had mentioned, habits can play a really big role in the way that the teeth develop and the way that the jaws are developing. Thumb sucking is a really bad one.
I believe it. How about the nook? Can that cause problems, or is that okay?
You know, at that age of development, when they're really young and still have the nook, it's not really an issue. It's when you get past the age of 5, 6 and the thumb is still in there, that's when things really start to develop that you want to
mine went past
nip
that.
in the bud. As long as you're not still doing it today, we're good. Yeah.
I'm not. So how do parents know? You know, what if they say, well, I think my child's smile is beautiful. How do they know if they need to get braces?
That's a great question. I get that asked that a lot. I mean, an easy way to kind of know if your kids need braces is to come in for an orthodontic consult. We recommend that every child have at least an orthodontic consult by the age of around 7 or 8, just to see how things are developing, how the baby teeth are falling out, permanent teeth are coming in, see if any treatment is warranted at that time. Another good way to do it is, you know, if you bring your child to the dentist regularly, you know, every 6 months. You know, the pediatric dentist can also kind of recommend, you know, when he or she sees something that might not quite be right, to go see an orthodontist.
So it can be younger than the age 9. Younger kids sometimes you address?
Yeah, I would say, it really depends, but the earliest I would say 7 or 8.
Okay.
You have to usually at least have the first permanent molars fully erupted in order to make appliances or put on braces. So that usually happens around 6 or 7.
My one of my friends who's my age, she's in her 30s, she just got braces because she couldn't afford them when she was younger.
Sure.
Cleaning them is a big issue, and you know, and a lot of people want to know, how do you most effectively clean them? So you brought several different displays and ways to clean.
Absolutely. So as an orthodontist, you know, I recommend brushing your teeth 2 to 3 times a day with braces on. The most important thing when you're brushing is that you're angling the toothbrush into the top and bottom of the braces, as well as cleaning the teeth themselves. I think a lot of kids especially miss the area right between their gum line and where the braces are, and so plaque will just really accumulate in that area. So that's something we really, you know, want to hit home with when they have the braces on. Another thing that's difficult or more difficult with braces is flossing. Yeah. Because obviously there's a wire that's running across the teeth.
And that brush is great for it, right? We're almost out of time, so I want to make sure that you demonstrate how to use it.
Absolutely. So these little brushes are great to get bigger chunks of food out of the back.
Oh, and it fits right in there.
Right
hold that real still. Right there. They'll get there. Perfect. Now show it.
So you can get right up underneath there.
Yeah.
And then also if you have spaces in your teeth, it can also go in between the back teeth.
Perfect. So you can get those anywhere?
Yep, any drugstore will have them. Yep.
Okay.
And then there's also different floss aids and floss threaders that can help kids as well.
That's great.
With cleaning their teeth. Yeah.
And I know new technology like Invisalign and things like that are other options as well. So I want to make sure everyone has the information for how to connect with you so they can find out if they need braces, or even if you're an adult, you couldn't afford them when you were younger, you're still looking to do them now. Here's where you can find a dental associates near you. Just visit them online at dentalassociates.com.